is to read, learn, grow. So parents, you play a part. First and foremost, reading from so young is advantageous. Link with the teachers, working hand in hand is a must. Just 10 minutes of your child reading to you is a plus. Get fun books, make reading priority. When children read, they are able to learn, and the more they learn, the more they grow. So parents help the kids read, learn, grow. Reading is fun, kids have to know. Read, learn, grow. The children are the future, help them read, learn, grow. So parents, you play a part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development. For more information, log on to www.oecs.org/ELP.
Good evening and welcome to another edition of Round Table Talk. This evening we're going to be talking about COVID-19 vaccines. That seems to be the talk these days here in St. Vincent and the Grenadines. We got news of the fact that we will be receiving some 45,600 vaccines from the COVAX facility. And also a vaccination process has already been started with members of the medical fraternity taking their vaccine. One of our panelists, has in fact taken his first jab, which is not from the batch that we will be getting or that we're expecting from the facility, but the Prime Minister and his wife as well, they have also taken that first jab. So have Dr. Keyser, Dr. Duncan, as well as some other members of the core staff. With us to discuss COVID vaccine and all things vaccine this evening, we have our special guest out of PAHO and WHO Eastern Caribbean and Barbados office, and she is none other than Darlene OMEIR. Welcome to you, Darlene OMEIR.
Thank you very much. It's a pleasure to be here tonight.
Great, and we also have our own Dr. JERROL Thompson, our in-house specialist in infectious diseases and also an advisor to the COVID task force here in St. Vincent and the Grenadines. I'm going to start out first by asking Darlene about the COVAX facility from which St. Vincent and the Grenadines will be accessing its initial share of vaccination. Tell us about the facility. How did it come about and how is it functioning?
Okay, so the COVAX facility is actually part of a full package called the Access to COVID-19 Tools. This includes treatment, research, and of course, prevention measures, and then the vaccine. So the COVAX is actually a component of a full package of the response to the COVID pandemic. And what the COVAX do is it has two main goals. One, to accelerate the development of vaccines and to support the manufacturers in this. And second, that once the vaccine is approved, to ensure fair and equitable access to all. So the facility sends out an invitation to various countries and asks them of their interest to be part of this initiative. It has countries, it has donors, it has private sector, everyone comes together. It's co-led by the Gavi, which is the Vaccine Alliance, and it's also led by the Coalition of Epidemic Preparedness, CEPI, and of course, WHO. And they pull together resources and they support manufacturers to scale up their capacity in researching and in developing a vaccine. And then when the vaccine now is developed, now there are several vaccines, and you're probably going to address that later. Now they're trying to ensure that the countries get access to these vaccines. So that's pretty much in a snapshot what the COVAX facility does. It's something new, developed in the context of the pandemic. But because of its successful work, everyone is thinking that this is something that should continue. Over.
So in terms of the actual allocations to the various countries, how do this happen? What is the process involved in allocating what and to whom?
So Gavi takes several criteria into account in allocation. There's a variety of things that has to do with the size of the population, the type of the stage of the epidemic in the country. So if it's community transmission or if it's sporadic cases, it takes into account the resources from the country. And I'm going to make a parenthesis here because Gavi also, of all the countries that are participating in the facility, in the COVAX facility, the countries are divided into two groups. And there's a group that we refer to as the AMC countries. And these countries are considered low and middle income countries that may not have available the resources to procure these vaccines. And that's 92 countries fall into category. And why I take this parenthesis is because St. Vincent is an AMC country. Hence, St. Vincent receives their vaccines via a donation from the facility. And they have several criteria, and I was mentioning to make the allocation. A lot has to do with the country's capacity to income, the size of the country, the stage of the epidemic, and other series that I can't bring up to mind at the moment. But key element is what stage that the epidemic is in the country, because obviously, if it's a country that does not have a minimum cases, they might not urgently need the vaccine, as opposed to a country that has strong community transmission. So St. Vincent is an AMC country in the COVAX facility.
Okay, thank you. Dr. Thompson, to all intents and purposes, vaccination has really gotten off the ground in St. Vincent and the Grenadines, though not with the allocation of the vaccines that we will be getting through the facility. Tell us how this has been going so far.
I believe his microphone is off.
Sorry about that. I was saying that I'm honored to have been one of the first 5 individuals, St. Vincent and the Grenadines, to have received the vaccine. And we would have received the Sputnik, what really should be called the Gamma COVID vaccine, better known as the Sputnik 5. And this is a Russian vaccine. But the point is that I got the injection, the first dose, and I'm waiting. I think it'll be another 16 days before I get my second dose. And I'm eagerly looking for that. The needle went in very easily. I did not feel a single thing. And I'm an individual, as a doctor, I've given thousands of vaccines and injections before. So I think I deserve to basically at least know what an injection feels like again. So I took it with pride. But you see, this is not about me. It's now that we have to look at the people of St. Vincent and the Grenadines. I mean, for me, I'm there to really demonstrate that if I, as a medical doctor, can receive the vaccine, and as you know, just yesterday, the Prime Minister received the vaccine. So if the Prime Minister could receive the vaccine and several other persons, then other people could receive it too. Because if I could say, Teresa, you know, last year we were doing quite well. Less than 100 cases over 9 months. And then in the last 5 weeks, over 1,000 cases in just that short period. Clearly, there's a spike, there's an outbreak, and it has come at a time, luckily, when we could see light at the end of the tunnel. We've done everything that we really could in terms of promoting hands, space, and face. That is the use of a mask. But now we need to promote hands, space, face, and vaccinate. And I'm hoping that this program will be able to get out that particular message of why people need to vaccinate, because it's now the next big step that we have to make to control this pandemic.
Okay, so Doc, yes, the process has started somewhat, but we are to receive our allocation from the COVAX facility. So what happens between now and the receipt of those allocations?
Well, I tell you, we do expect to receive some 11,000 vaccines, which will be able to vaccinate about 5,500 persons. I must tell you that because we really respect the concept of COVAX and so, but out there's what we call vaccine nationalism. And there may be some slowing of the process of vaccines coming and the urgency. We're also exploring other sources of the vaccine, which may not come through necessarily the World Health Organization. So we are exploring the Russian Sputnik vaccine, and we do have also some additional good news in that regard. But we expect that probably within the next week to week and a half, we'll have those 11,000 vaccines to vaccinate 5,500 persons. And we have started the process of preparing to vaccinate our healthcare workers and the elderly who are in the first tier. We will have a second tier later on with respect to other vulnerable persons, diabetic, hypertensive, arthritics, asthmatics, and so forth, as well as our policemen, our customs officers, our port workers, and other things like that. But we also have to prepare by educating our people, letting them know and understand all about the vaccine, what it's all about, what are the potential side effects, what are the adverse effects, and giving them all the information possible without holding anything back. Because at the same time, we know there are a lot of entities out there who don't want people to take any vaccine for whatever reason they have. And we'll come to that, I'm sure, in due course. We have to deal with that. But it's now about education. It's now about informing our people and being honest with our people, upfront with our people, telling them exactly what is taking place every step of the way. And I think that we have, we're going to do a fairly good job at that in terms of the whole public education aspect about vaccines.
Okay, Doc, I don't know whether you want to take this one or Darlene wants to take this one. How are vaccines made?
Darlene, you make a first stab at that and I'll come in after.
Okay. So if I had to summarize it, I would tell you in 3 ways, or rather saying there are 2 types of vaccine. There is one that is made from the virus itself. Of course, this virus is inactivated, so it cannot produce the sickness. There is one that's made from parts of the virus. And then the third one that's made from the genetic component of the virus. But at the end, what the target is to have the body exposed to some form of the virus so that the body could believe it's the virus and develop antigens. And we need to have those antigens, let's consider them sort of our defense weapon. We need to have them ready and alert. So when the actual real virus comes, they are ready to react and respond and defend us. And we would then not get the sickness. So the various vaccines that we've heard out there, and I think at this point we have like 12 different vaccines circulating, are either made of one of these 3 forms. But the overall target, as I said before, is to prepare the body so that the body could start generating these antigens. So whenever he is exposed with the actual virus, we would be ready to defend ourselves. I don't know, Doctor, if you want to add something to that. I was being very, very...
Yes, I know. And you know, in terms of making things simplified, because we really can't go into the real microscopic details, Teresa, but we've been having vaccines for a long, long time. As a matter of fact, our children receive vaccines. Your mumps, your measles, your rubella, polio, they're all sorts of different. And as was said, they've been making vaccines for a long time. And they've been doing a fairly good job. Matter of fact, I am pleased that St. Vincent has 99.5% vaccination rate of our childhood illnesses. And it's been going well. We have an excellent record. And over the last 40 years, we've not had a single case of measles, mumps, rubella, any of those things. It's wonderful. Our healthcare workers done a great job. Now, some of these vaccines, like the Moderna and the Pfizer, they have been developed in a similar way. And they've used the same method in relation to what Darlene was talking about, one of those methods. And then the Oxford University AstraZeneca, the Sputnik, and the Johnson & Johnson, they've used a different method, very similar. And then some of the Chinese vaccines, and they've used the inactivated virus format. So it's difficult to tell persons in terms of how these vaccines are made, and we really do have to try and explain it. But those first two, these are some new but modern methods of making vaccines. And I think that they have really done a great job, which have added greater safety, or greater safeguards, I should say, and they've had a new method of getting effectiveness, such that I am impressed that the effectiveness of some of these vaccines have been that high. I mean, we had to say the pass mark is 50%. 50%, just like you go to school and you get a C with 50%. I'm sure I had not expected it, but we've been seeing pass marks. We've been seeing efficacy rates of 95, 94, 92, 90% in some vaccines, although some of the other vaccines have come out, have had lower efficacy, and we are going to be able to tell people which ones have what kind of effectiveness and what is the safety profile of all these vaccines.
Okay, so when we come back from our first break, we want to talk a little bit more about why this huge variety of vaccines in the first place, and what do vaccines actually do, and how do you respond to people who say that they don't want the same virus to be injected into their bodies? We'll talk about that when we come back, and just to remind viewers that you can send your questions, comments, concerns to our Facebook or YouTube pages. We'll be back in just a moment.
Good morning, everybody. Welcome to our staff meeting. We'll now have the minutes of the last meeting.
Miss Peters, you don't know it's bad manners to cough and don't cover your mouth?
Well, listen, I have a common cold, and at some point, it is expected that I'm either going to cough or sneeze. So you all don't have to be that dramatic.
But we don't know if it's cold or COVID. Some people like be wrong and strong. Imagine you cough and don't cover your mouth, and because people talk is a problem.
Well, no wonder COVID spreading like wildfire across the world.
None of you can give me all the virus in here, you know.
Is that I practice good hygiene or I stay at home? I ain't able.
Well, seeing that you know so much about proper hygiene, enlighten me now.
What you mean? It's common knowledge. If you have to cough or sneeze, you cover your mouth with a tissue or the cuff of your elbow so that the virus won't spread in the atmosphere. That's it. It's not rocket science.
Okay, Miss Know It All. Now I know better, I will do better.
Remember, it's not about who knows it all. Our health is a shared responsibility. For our next staff development session, I'm going to ask a medical doctor to discuss respiratory hygiene with us. So let's get back to our meeting.
Diabetes is among the top 3 leading causes of death. Are you living with diabetes? If so, you may be at risk for developing complications, especially during this COVID pandemic. Let's tackle this problem by complying with taking your medication, increasing your physical activities, increasing eating a balanced and nutritious diet, checking your feet as foot care is important, and contacting your healthcare provider. Remember, diabetes can lead to blindness, amputation, and numerous harmful and life-threatening effects. Protect yourself. Know your numbers. Hearts Movement SVG reminds you to love your body and treat it right. Your health, a shared responsibility.
Welcome back. Doc, I think at the break, I wanted us to talk a little bit about exactly what the vaccine does, how it does that, and in particular, these COVID-19 vaccines that have been developed within recent times. I also want to talk, and maybe from there, Darlene could talk about the fact that people have expressed some concern that the vaccine seems to be rushed, when in fact it really isn't rushed. So we want to explain that process as well to those who may have had their concerns.
You want me to go first?
No, you can go first. Fine.
Okay, so yes, why have the vaccine been developed so fast when we have said before that usually vaccines take, the shortest one has been 4 years so far. And in this case, we had a vaccine in a little below a year. So this has been a concern or expressed concern among the population to sort of reduce the credibility in the vaccine. So I'll say there are several things. One important factor that this vaccine had is funding. As opposed to many other vaccine research and medicine research, etc., having funds is crucial to advance or to scale up anything. And in this case, as I mentioned before, the COVAX facility pulled together funds and were providing funds to the various manufacturers so they could scale up and continue their research. So of course, this was an element that in some other vaccines, it took years. For the COVID-19 vaccine, it was a matter of weeks. Now, the other thing important to note as well is that the vaccine was also, vaccines also require trials, and they require volunteers, and they require people to as volunteers for this. And as opposed to other vaccines that it takes years to actually meet the target, COVID-19 vaccine, and you probably saw it on the news, there were